So I'm just, so if you don't, we'll try to put it in the chat, and if not in the recording when we put the recording back online. Okay, so I want you to pay attention. We see that Omicron is BA.11 and BA.11.529 are sort of the main ones, and that's the deep purple and the sort of lighter purple. But if you look at February, the last arrow, February 12th, 2022, and you'll see a really light, that really light purple that's right at the top. So right now there's a stealth Omicron, which is BA.2. It's only about 4% of the cases right now. Which is kind of good. It's a good thing. It's only 4%. But I also want to remind everyone that, when Omicron first began, when BA.1.1 started, it was a very small percentage of the cases as well. So if you look back to like 11 all the way to the right, 11, 13, 21, you can see it was a little tiny purple up at the top. And it was that way for several weeks. And then it doubled, then it tripled, and then before you knew it, like in 3 or 4 weeks, it became the predominant variant. So it's important that we watch BA.2 to see what it's going to do, and to see how fast it's going to triple. So we're going to be watching that next week. We're going to look to see if it gets up to 8%. And we're going to see how fast it's doubling. They say right now that it is more transmissible than the other versions of Omicron. And the scientists were already amazed at how fast how transmissible Omicron was by, the regular one, Omicron BA.1, and comparing it to being just slightly under the transmissibility of the measles. So here's another version of COVID that is even more transmissible. And so it does raise some concerns. And the reason why I'm bringing that up now, because I know a lot of us are in situations where case rates are falling, death rates are falling. No, not death rates. Case rates are falling, infection rates are falling, hospitalization rates are falling, but the death rates at 8% is not really falling that much. But you see the daily reported case rates are falling now by 40%, hospitalizations by 22%, death rates are only falling down by 8%. Now we know that the death rates will fall down. Those are the last numbers to change. Got it, I understand that. But we're doing this in the midst of, we're doing all of this in the midst of, like, the UK has decided, Boris Johnson has decided to get rid of all of the mandates. Everybody is up, it's all on your own. You don't even have to quarantine if you are, I'm going to take this off now. You don't even have to quarantine if you are if you test positive. So what does that mean? What does that mean for you? What does that mean for your family? What are they trying to say to the universe? Well, the scientists are not in agreement with a lot, the stopping of the mask mandates or the vaccine or the biosafety tactics. We've talked for a while on this, on these Zoom casts, that a lot of decisions are made based upon politics or what's good for the economy, and not necessarily what's the safest thing to do scientifically. And So we've been hoping that in teaching you the science, you can make better decisions for yourself, the best decisions for yourself and your loved ones based on science, not based on somebody else's pocketbook. And this is not to say that you can't have fun and go, because we've been trying to show you that. Yeah, you can go have fun, you can be safe and you can still have fun. You can be safe and still spend money. But they're sort of not teaching people how to be safe, not at all. So we know that this is, some level, this is just a huge experiment. Stealth Omicron is here. We don't know what the vaccine efficacy is against, not for sure, against stealth Omicron BA.2. We don't know for sure, right now today, we don't know for sure how effective the monoclonal antibodies are going to be against BA.2. We don't know for sure. And there's some talk about the stealth or BA.2 having its own Greek letter. It's been found from coast to coast. So it's everywhere, and it's in just about every region of the United States. So it's not like it's just like in some small area all on its own or by itself. It's not, it's all over the United States. And but again, we don't know how fast it's doubling, and we won't really know until next week. And I'll pull up next week, you'll have the new the new variant tracker, and we'll talk about that. Okay, so what does this mean for us, for the general public? They're lowering the mask mandates and all that. They did it massively in the UK. In Chicago, they're talking on February 28th. There won't be any mask mandates for bars or for restaurants. And I believe the vaccine, there won't be any government regulated mandates, but individuals, private organizations, private businesses can make whatever mandates they want to make. But there won't be any state or city legislation requiring masks and that kind of thing. So, and they're basing it on, yes, Omicron rates, and right now, the hospital rates are going down, infection rates are going down. It seems like there's a lull at best. There's a lull. And so enjoy the lull. Don't get me wrong, enjoy the lull, but understand that it is just a lull. Doesn't mean that it won't go back up. And it doesn't mean that you, as far as I'm concerned, it doesn't mean that you should be changing any of your biosafety protocols. There's a couple of big experiments that's getting ready to happen. So if we look, I'm sorry, Patricia, that you are in an experiment. But we're going to know in a few short weeks. We're going to be looking at London's numbers. What's happening in the UK? Look at their numbers. Once they got rid of everything, what happened? I'm telling Patricia, and I'm telling everybody in London or everybody else that's in the sound of my voice, keep your guard up, and keep your mask up too. This is a big experiment. They don't really know what's going to happen. And if Omicron and stuff takes off, this could be a real, as I say, shit show coming up in about 4 weeks. So here's another experiment that's getting ready to happen. So I don't want anybody to think, oh, that's just what's happening in the UK. No, there's a big music festival called Coachella. Many of you may be aware of or heard of it, Coachella. Big name folks are coming up there. The tickets, it's an outdoor festival outside of Riverside, California, in a town called Coachella. There will be all the tickets are sold out. They're sold out like within an hour and 15 minutes. They're expecting 100,000 people to descend on this town There's no mask mandates, no requirements for testing to have a negative COVID test, no requirements for vaccination. So that's going to happen. I believe there's 2 weekends in April that will take place. So we're going to find out after Coachella, about 2 weeks after Coachella, what do the numbers look like? And that will be people that will be coming from all over the country to descend on this place in Riverside, California. So we're going to find out. We're going to find out if the vaccines work, because I'm sure at some point they're going to be taking a look at, okay, how many people got COVID? Were they vaccinated or not? Who had a severe illness? Who died? I'm just asking you not to be a part of that experiment. No.
Doctor, do you think they'll crosshair with all the people who went to the Super Bowl?
Yeah, because that was, but also understand that the Super Bowl was with BA.1, the first type of Omicron. So that's gonna have some bearing too. And we don't know, because the death rates haven't gone down. You kind of wonder if, well, it takes about 40 days for people to actually get COVID and die. So yeah, so it hasn't been 40 days since the Super Bowl. And understand that the people who were at the Super Bowl probably would have been exposed to BA.1, not the stealth version. The stealth version, if it takes off, if it takes off, it will be, and it should be like really predominant by the time Coachella happens. Okay, because and we will be able to see the rise in the stealth variant over the next 3 weeks. Now, this is the end of, well, not quite, but almost the end of February. So by the end of March, we'll know if that stealth version is really going to have explosive growth, and it might coincide right at the time that Coachella is getting ready to happen. So I don't know what to say. I'm not trying to spell doom and gloom or anything like that. I'm just saying, you've lived this long, you made it this far. Just understand what your health risks are. I'm not planning to be out there willy-nilly. I'm not gonna put myself out there and I'm not taking, just because other people might decide that they're gonna take off their mask. I'm gonna have my ionizer on anyway. I might choose to wear my mask anyway with the ionizer. I might still take depending on the circumstances, I might have my air purifier with me anyway. Because there's certain things you just can't control about the environment in terms of what some of the things that might happen in the environment. Did I answer your question, Justin? I'm sorry.
No, you did. What I took from that is to just protect myself from all angles, especially since I'm out here. I live in LA, so some of the people from LA are going to Coachella to then come back to the city and live their normal, natural lives. Right. With those of us who didn't go, I'm gonna just stay in the house for a bit. It's a lot.
I'm not saying you got to stay in the house. All I'm saying is, just because other people are taking their masks off, you have an ionizer, use it. I'm just saying, use it. Use your skin guard, use your ionizer, use your mask. Don't put away those tools just yet.
Right.
We're looking at the data. They're not sure. They're not. This just. As a scientist, sometimes the scientists are basically have been saying, well, there's certain things we don't know the answer to. We still have the data has yet to be collected. There are still questions that have not been answered. So, we're going to have some answers around Omicron BA.1, and whether it's, and whether the vaccines really protect us or not. They do appear to be protective. We're going to have, hopefully, there's going to be people who are going to take the new vaccine. Covovax is out. No, sorry, it's available in Canada now. Hopefully by the end of this month, it will have its emergency use authorization. So we hope that those people who might have been concerned about taking an mRNA-based vaccine will then choose to take
At first, do not spend more than 15 minutes in projecting or trying.
So, so there, there are there's so many other variables that will come into play in terms of how the hospitalization rates or how the infection rates play out, but at the end of the day, it is going to be the death rates either you died of COVID or you didn't. I mean, that's probably the most significant one that we have to take a look at, because we're not going to be able to, test it. People are self-testing, so they're not going to be able to capture all of the infections and really have a good number on the infection rate. Hospitalization rates, yeah, those will be pretty solid numbers. And so, so I think our government is more concerned about, making sure that the money flow continues. And I can understand that. I mean, the economy does have to keep going on, and they're concerned about whether, not overwhelming the hospitals. So I get that, because I'm sitting up here now thinking about, I might need to have hip replacement surgery. Do I want to go into the hospital right now because COVID is out there? So people are forestalling, perhaps medical tests or medical procedures because of COVID and that kind of thing. So I totally get, being concerned. Yeah, I'd like for this to be over with. People are tired of it. I get it. But it's not over with until the virus says it's over. We haven't seen the signs that would indicate that the virus or this pandemic is over. My child said, because he sent me a news clipping about how the Queen of England got COVID. And he was curious, like, how could somebody who must be protected beyond, ultimate protection, how did she get COVID? How did she get COVID? So that we all must be doomed if she got COVID. And I jokingly, I hope you, Patricia, I hope you're not offended when I say this, but I jokingly said, well, she got it from her son. As soon as she told her son that Camilla could be queen, he went over and gave his mama COVID so he could become the king. Because every day, because she's been queen for a long time, and he just can't wait to be king, So yeah, I don't know. I don't know how, but I don't think that we're doomed. I do think that when we give up our masks and our ionizers and don't test and do the things that keep our elders safe, that we put them at risk and we put them in danger. And that's what I talked about, because there's some elders that we go visit, and I told them, I said, we're not going to take anything to the Hutchinsons, who are the elders that we go visit, who are 92 and 97. And that's why we do these things, to make sure that we're taking care of them. So when is COVID over? Well, first of all, we don't have a cure for COVID. So that's number one. Is there a cure? That would be one indication that this is kind of over when we have a cure. Although we have multiple, we've got at least one monoclonal antibody treatment that right now is working on Omicron BA.1. We don't know if it works on BA.2 yet, but we'll in the next 2 to 3 weeks we'll find out. And then there's Paxlovid, Paxlovid, and that's still in clinical trials, has gotten its emergency use authorization, but it's still not, we're still not certain that this is the trick, that it would do the trick. But we do have, at least there seems to be a cure that may be on the horizon. So when is COVID over? One, when there's a cure. Two, when is COVID over? When flu deaths are at pre-pandemic levels. Well, we haven't reached that yet. Third, when COVID is gone from the wastewater. So the CDC just started posting that data on its website, and it's still not, it's not consumer friendly at all. It's not user friendly at all yet. So it's still under development. Not every area is accessible. The data for every area is not accessible. So, so those three things haven't happened. So when might be the other way that, we could say COVID is over? Well, in the absence of a cure or COVID being gone from the wastewater, COVID is over when you and the members of your household are able to practice the biosafety protocols with fidelity, and you can get back to you are back to your pretty much your regular life, your normal life. So, but that means living with COVID, and living with COVID doesn't necessarily mean without a mask or without an ionizer or without a good hand sanitizer. It might mean living with those things and knowing how to use them and being aware of your health status, and the health status of the people in your household, so that you can make good decisions about what you're going to do. I think it's vitally important to have the items that we talked about. Yesterday I took a friend of mine to lunch, and I'm glad that I'm here in Hawaii, because sometimes it's best to kind of teach the biosafety protocols in person. So we went out to lunch together, and I had all of our stuff. I had the hand sanitizer, and I explained how to use that, and of course she had, they had good masks, or they had the N95s, but I explained the difference between an N95 versus the Living Guard mask. And she saw the ionizer that was around my neck, and she asked me about that. And, and she's like, and she is, Sharon is very cautious and love her to death. She takes very good care of her husband, who, has some challenges right now, some health challenges right now. And they always eat outside, and, and she always, she picked a good table. So I'm watching what she's doing, right? And then at some point during the lunch, there was a table next to us, but there was a guy who was sitting at the table next to us, and he was just a little bit too close. And I said to Sharon, and she got a little like, because he was within 3 feet of her. And but that was an opportunity to talk with her about, well, this is where having an ionizer comes in handy, because there's some things you can't control. You can't control that they sat this group at this table next to us. This man, yes, it is breezy on the outside. We are definitely in an outdoor, and it's breeze in 3 directions. But this man is sitting within 3 feet of you, right next to you. And on top of that, he's kind of pushed back from the table. So he just kind of like taking up, some space here. And I said, but if you had an ionizer on, that wouldn't even be a word. That's just one less, And she was like, she ordered an ionizer right then and there, and she got it. But sometimes it takes that. It takes being in the situation and have it happen to you, and you said, oh, okay, this is when you would, it's like, I'm not worried about what he's doing or who comes and sit maybe too close to me, even if I'm outside. So, just because, you're in an outdoor venue, that doesn't give you automatic protection. It's, if you're outdoors and you're far away from other people, great. But what happens if, like in this situation, somebody sits down at the table next to you, they decide to push their chair back from the table. And so they kind of sort of, they're not in your space necessarily, but they're less than 3 feet away from you, and that's even eating outside. So those are the kinds of things that having an ionizer in the living guard mask and the skin guard, those 3 things, and you can pretty much travel the world and do everything that you might want to do, as long as you're doing that. You have your tools. So again, all I can say is keep your guard up and keep your mask up too. Now I'm going to take some questions. See if we have what's in the chat. Ooh, got lots of things in the chat. Okay, so take pictures. Okay, I think I put if you're my Facebook friends, you probably I put the pictures of the house on my Facebook page, but we can post it. I'll share it to the Auset-Isis link. You can get it on. You can find the house on Airbnb too. So so it's available to rent for anybody. So that's nice. Oh, great. Thank you, Justin, for putting the tracker on there, the data tracker on there. I appreciate that. Yes, Carol Wright mentioned numbers might be down because of the home testing and those cases not being reported. You are absolutely right, Carol. They are not, the infection rates are not an adequate measure right now because people are doing a lot of home testing. And so we're not sure. We're not sure what the infection rates are. And people may not necessarily go in, and even if they got a positive antigen test, they may not necessarily go in for a PCR test unless they got like really sick. So if people had a positive antigen test and then had mild symptoms, they may not necessarily, go take it any further than that. So Carol, can you come on, Carol? Because you said you heard from an epidemiologist today who is very against the dropping of the mandates and acting as everything else is normal. Can you tell us a little bit more about that conversation? I'd love to hear from you.
I was just listening to him on a news program, and he was just saying that he thought that people were moving too quickly with dropping the mandates and everybody not, practicing wearing masks and all that. He just said he felt that it was just too quick.
Okay. Well,
he was the person that said, the numbers being down are not the only indicator that we should be looking at because of the home testing, and they came out with a story today. I also saw that, Denmark was one of the first ones to drop their mandates, and now their numbers have spiked again. I saw that article today.
so you said the numbers are going up.
Yes, they've gone up dramatically.
Yes, I saw that same article too, Carol.
You said, did I hear you right? That you said they went up dramatically?
Yes.
Okay. And I think BA2 was more prevalent over there as well. I think they had a higher percentage of cases of BA2 over there. I'm not sure.
He talked about the BA2 as well, and he also said, he's expecting way more variants.
Right.
Because we're not getting it under control the first time. We just keep going from one thing to another without ever being in a situation where it's under control.
Excuse me.
Mhm.
Who? I'm sorry. Whose numbers went up?
Denmark,
Denmark.
yes,
Okay. Thank you.
So, so the way to get this virus under control really is to stop giving it bodies to feed on.
Right.
And that's what people don't seem to understand. That it's like you don't give it a host.
They're giving me the heebie-jeebies every time I look at sports stuff with the Super Bowl, the All-Star game this past weekend, and everything on television. It's like the appearance that there's no such thing as a virus anymore. And you remember a few weeks ago, I was talking about how the healthcare system, they're losing nurses. They said there's going to be about 53% of the medical field is nurses. And they said they're losing nurses in droves.
Right. That is a serious problem. On a number of different levels, not only because you have fewer nurses to actually treat COVID patients who require a lot of what I would call more intensive nursing care, but also people who are going into the hospital for other reasons. Like, I visited a friend of mine who's here on Maui, in the Maui hospital, was certainly overwhelmed. She got a hip replacement surgery, and they kind of rushed her out of the hospital, and she's still having problems, with that hip now. She believes it's because they made her leave the hospital before she was really ready to go.
Yeah, and I know of somebody that had back surgery. And with back surgery, you're pretty stagnant for a little while. And so she ended up developing blood clots in her lungs. And she had COVID, or the whole house had COVID, but she ended up developing blood clots in her lungs. And she stayed in the emergency room just in the hallway for several days. And then they were just gonna release her. They gave her some blood thinners. They were just gonna release her. No monitoring, no anything. And so that her family was trying to see if she could get transferred to a different hospital, but I don't know the outcome. I guess she's okay because I haven't heard otherwise, but they were gonna try to get her transferred to another hospital because she hadn't really been seen and never was admitted because there was not any room.
Wow.
That's that rationing of care that you and I talked about last week, Dr. Blessman.
Right.
This is a very real life event, events that are happening to people. It might not be happening to us in this room, but it is happening. And if you don't have people to advocate for you, or you don't understand what advocating is, then your health hangs in the balance. Not only is the BA2, traveling, and we can expect it to bear down on us in the next month. They are now getting reports back from people who have long haul COVID, and that it is now messing with people's hearts and circulation. So the blood clots, of course, and other ailments. So we're really not out of the woods with this virus, even when, maybe we can see a light at the end of the tunnel. There will be long-term illnesses and issues and problems. And with us losing, our healthcare workers, it's going to be very difficult for us to manage our health at that level, at the hospital system level.
Because at this point, they're saying that even if you graduated, you couldn't graduate enough nurses today, right now today, even if you had every nursing school spot filled, you can't fulfill the gap in numbers. It would take years to replace the number of nurses that have already left the field in terms of training and onboarding. So they're talking like 5-10 years just to replace the nurses that have left. And there would have to be, of course, a mad dash of people trying to, get into nursing school or whatever.
Right.
So our nursing, our hospital system has been basically permanently changed.
Mm-hmm.
Certainly altered, in significant ways, and we're not going to see. I don't know how what they can do to recover that, or recover from that, unless there's some.
They would have to start getting nurses from other countries.
That is happening already.
Mm-hmm.
They start coming in from other countries because the pay has gotten
Mm-hmm.
very good to do that.
Mm-hmm.
But again, there's going to be a nursing shortage
Mm-hmm.
all the way. I mean, not only they're coming from other countries, but then what do those countries do?
Right, go globally, right. Internationally, right.
Yeah.
Mm-hmm.
So, absolutely.
Mm-hmm. Ms. Williams has a question in the chat, but I wanted to tell her, I read an article, Kaiser Permanente was advocating for pneumococcal, I want to say it was 13. Sister Marjorie knows a little bit more about it, knows as much as I do too. Everyone doesn't offer or gives a different opinion about the pneumonia vaccine, pneumococcal. And forgive me, family, I've worked all day training, so my thinking skills, I'm short. So the pneumococcal, right? So before this virus came to fruition, not many people were getting pneumonia vaccines. Some understood the importance, but now that this virus has been so prevalent, and I want to, shout out to Dr. Rowland for bringing me to the understanding of these pneumococcal vaccines, and the fact that we can go get them. I am noticing more commercials with talking about getting this pneumonia vaccine. So the offerings are different for different pharmaceutical companies. CVS might offer the Pneumovax 23. They might have every one in stock. The Prevnar is probably offered at Walgreens because the pharmaceutical companies have a deal with Walgreens. So that's how you end up with various offerings of the pneumococcal vaccines. But I know that Kaiser Permanente suggested that we get a different vaccine than the one that Dr. Rowland had told us about. But I want to say that they're all in the same family. Pneumococcal 13, 23, Prevnar 20.
Right.
It's all now some money. It's all about the money right now.
Right. And truth be told, a lot of lives could have been saved if they had been in people to get the pneumococcal
Yes.
vaccine, the pneumonia vaccine.
Yes.
Very start of this to begin with.
Yeah. That's true.
Because, we went in lockdown in March.
Hmm.
So we had at least a good 6 months run up till November,
Hmm.
started the flu and cold season.
Right.
And I know for a fact that I got my pneumonia vaccines the fall of 2020.
Hmm.
So, but yeah, a lot of lives could have been saved simply by having done that first, because they knew at that point that the people who were getting intubated and the people who were dying from uh, COVID were dying from pneumonia, a bacterial, basically.
Hmm. Hmm.
So
Hmm.
I'm glad I got, yes. So I don't know that, I'm not a physician, so I don't know what specifically I would recommend for any specific person, but they are in the same family. It does make sense to get the pneumonia vaccine
Hmm.
if you, especially if you are not vaccinated.
Yeah.
It would be a really good idea to get the pneumonia vaccine so
Hmm.
that at least offers you some level of protection.
Yeah.
Should you?
Hmm. Dr. Blessman is so, I love how she says this experiment, right? Because that's a very calm and nice way to put this, is this experiment that is happening to us, because this is 2022. And we started with understanding COVID being part of our visceral in 2019. And we have went through several iterations of this vaccine. And we know what will suppress this vaccine. We know exactly what we need to do. And it's not going to happen because of greed. And just like we do our research, just like Dr. Blessman brings us the graphs, how this virus is spreading, where it's spreading to, there are links you can go to your community and see what virus is prevalent in, you know, miles of your zip code. Um, they have antigen testing, PCR testing. We got home kits. We have, you know, various masks from a cloth paper. I mean, you could spend $1,000 on a mask, or you can spend 50 cents on a mask. We know that alcohol will kill COVID. We have our products. Some people have HOCl. Some people in our community have Clean Smart. The same information that's available to us just as lay people and not particularly scientists is the same information that's available to our politicians. And they have the experts in the room. They have scientists that can explain to them the R not, just like Dr. Blessman and I can explain it to you. They have speech writers and a research team, and they have access to all this data. And maybe, now that we got the home test, people are really not reporting. So you have home tests, you have COVID, you have COVID, but the babysitter don't know that you have COVID because you feel fine. So that's not being reported. We know about the wastewater, right? We know that counties, city, towns, townships, they can test the wastewater to find out where the COVID is, whether your township does it or not. But you can do that. That's that information is available. That technique is out there. So why would you, when the death rate is still 2,300 people a day dying, why would you relax these mandates? Why would you stop? Why would you not encourage people to wear their mask and get the best mask, or search out the best hand sanitizer? We got it. We know we have air caves. So just like we have all this information, they know what ethnicities will succumb to this virus. They know who's at the greatest risk. They know who has HIV, AIDS. If you have cancer, they know you got it. And so at some point, you know, human life is not valued at all. It's the dollar is valued. So, you know, I'll go a little bit further than Dr. Blessman and say, you know, they're hoping that some people will leave. Because at some point, some things are just complete. People can be a burden on the system. And if we let down our guard, I'm going to use Dr. Blessman's terminology, then you're a part of the experiment. Can you sustain these waves of this virus?
And I'm not suggesting that we have to sustain it forever. I do pray for the day that this is really over.
Me too.
That we can say, goodbye, and have a goodbye party for everybody here. We made it through to the other side. We're gonna have we lived and thrived, not just survived party, shoot off some confetti and regale each other with things that we did that we didn't think that we would do, but we did it during a pandemic. I'm hoping that, I'm already envisioning the end to some extent. I would love, I'm loving for that day to come. I'm loving for that day to come. I just don't think that we're there today. And I don't want people to be drawn in or sucked in by folks who might be in a little bit of denial. Because just even listening to Lori Lightfoot and who's our Chicago mayor, and the health experts, and they were like, yeah, we know BA2, we had to monitor BA2, but we're gonna open up the restaurants, and it's up to each individual restaurant to decide whether they're gonna have a mask mandate or have a vaccine mandate, and and they're rolling right on, and they kind of even just said, we don't want to go back to shutting everything down. We can't afford to shut everything down. They actually said it. We can't afford to shut everything down. And I totally, I know what kind of havoc, not having a good economy can wreak. I get that. I was, even when I'm here in Honolulu, I've been to Honolulu before. I've been when, the pre-pandemic. And I was with a friend of mine who lives here. He was telling me about how the early stage of the pandemic, it was like a ghost town, walking down Ala Moana Boulevard, Kalakaua Avenue, where all of the luxury retail outlets are. There was no booming life going on in downtown Oahu. Waikiki was pretty empty, and he was talking about it looked like a ghost town. Now, it's a little bit more bustling now. It's still kind of light, but it looks more bustling now. The restaurants open, so the bars open. A lot of stuff have closed down. Some of our favorite restaurants are no longer here. A lot, like 30% of the restaurants in Chinatown are no longer there. Some of our favorites, Gordon Biersch is no longer on the waterfront. So some of our favorites have closed down, but it's more bustling now. And Honolulu is a big tourist destination, particularly for people who were coming in from Asia, for this state. So I get that, you know, about wanting the economy and wanting to have a robust economy. But it's also, and I'm not saying that you know, I'm here, you know, yeah, but I'm here with my friends and we are very safe. Okay. They get all the stuff. Okay. I wrote the protocols. Everybody bought the stuff that they need to get, and we're doing it safely. And if they would teach people, it's the part that upsets me is that they were not teaching people how to be safe through this.
Exactly.
Exactly.
That's that part, doctor.
That part.
That part.
Exactly. And that there was just no emphasis or willingness to spend any time or attention on that part, on that piece of it. Right. So yeah, we're having a house party here. We're doing it safely. We're gonna go see David Swanson at I have to look it up, but the Moana Surf Rider on Friday night. But everybody, it's like, okay, we know the lay of the land. Everybody's got their stuff, and we're gonna go there safely. But it's like, okay, but to walk through this pandemic and act like, okay, we're just gonna go, we're gonna approach this as like pre-pandemic times, and you just throw away your mask, throw away all your biosafety protocols, throw them into the dustpan and just carry on. No, that I don't agree with. That I don't agree with. So you'll see, I have some videos. There will be videos of my trip. You'll see that I packed my little stuff, and I have a little video with my little container with all my little stuff. And people here, like I said, I love doing teachings in person. So the ladies here have been, I pulled out my bag and I showed them, oh yeah, I have all my stuff packed in my little bag. Here it is, and we're comparing this, and it's like, they're showing me their stuff and how they packed it up, and we still carrying our little cute bags, and we're still doing what we need to do, but we're doing it safely, and that's all I can admonish. I mean, you're here. If you're here listening and being a part of this Zoom cast, then you're already there. You're there. And all I can do is just ask that you model and demonstrate and teach the people around you. Reach out to the people that are your loved ones so that they can stay safe too. But this is, one of the ladies that I work with. In fact, the lady whose birthday it is, Connie, she has spent the last 2 years being pretty much isolated. She's like, and she contacted me in September. She said, I want to go to Maui, I want to go to Honolulu for my birthday. I haven't been out anywhere, haven't done anything, and was afraid. And I said, okay, I'm gonna teach you how not to be afraid. I'm gonna teach you what it is that you need to know so that you can live and thrive and not just survive during this pandemic. Show you all the tools, teach you how to use them. And she came here February 2nd. And the biggest thrill to me when she got here was she said, I went through the whole process, getting on a plane. She's highly motivated because she's going to Hawaii and she loves Hawaii. But she said, I felt so comfortable. I felt so safe. I knew exactly what to do to stay safe. I knew it, and when you empower people and they have that sense of agency over their life and that they can do it and stay safe and have fun, that is the best feeling in the world. And that's some of the reason why I love doing this Zoom cast every week, because I know that there are people in this community who have done things, that went on trips, moved across country, did things, had wedding celebrations, had birthday parties, did the things that they needed or wanted to do because they learned what tools they needed and learned how to use them so they could come together safely and still have fun. That's why we're here. And I just wish that was a message, that we could get across. Well, let me say this a different way. I don't know what it's going to take for folks to get that message, but I'm confident that over time, people will eventually learn and figure it out. Because you don't have to live in fear. You don't have to go back to pre-pandemic, nostalgia, denial, with a few changes now, a few very minor changes. You can go ahead and live your life and live it safely. It's really not a big deal at the end of the day. It's really not. So any other questions?
I want to kind of keep with our theme a little bit. Great conversation.
Oh,
but I did have because I knew we didn't have a PowerPoint presentation about that cube, but I have a couple of articles I want to put in the chat.
Okay.
For people to grab. So this one that I just shared is a mask.
That Korean face mask?
Yes, and it's being.
You have a picture of it? Do you have a picture?
I think, yes, I do. Let me see, I have to show it to you.
So.
This is so this is the picture of the mask here. Oh, I'm not sharing. Here it goes. Share. Can you see that?
Yeah, I can see it.
Yeah, so this is so people can eat.
Okay, stop right there. Stop right there. Mm-hmm. Don't go off any further. Maybe it was above that. Because I think they told the rating.
Oh, down at the bottom.
There's somewhere they had the rating for it.
There's an 80% filtration capability.
Okay. So yeah. So you see that 80% filtration. So now go back up to the picture, right? Okay. So I just want our audience, because this is a test. I want to know, who in our audience can tell us what the frick is wrong with this?
Not covering her mouth.
Yep.
And that 80% filtration is just not enough.
Correct. So even if you had it covering your mouth, it's 80% filtration. So, and the reason why we're bringing this up is because, as you know, you're going to be exposed to all different kinds of stuff. And hopefully we've given you the tools to think through evaluating and crossing off, like, okay, that's pointless, that's useless, that's no good, don't even think about it. There's certain things that are going to be out there that just don't make sense.
That's one of them.
And I'm sorry, say that again.
I said that's one of them.
The N95 particulate?
No, that Korean mask.
That's not what. Yeah,
that doesn't make sense.
That doesn't make sense. At all.
You get away with it if you have your ionizer on.
Well, yeah, but what would be the point of even buying it?
Right, I wouldn't waste money
at all. Money.
Yeah.
But this is coming from the CDC? This is from the CDC?
No.
No. The CDC doesn't recommend this mask.
Okay.
The Korean mask.
Yeah.
And not necessarily, I mean, finally what the CDC finally, finally got wise, and at least started talking about N95s, but, but still an N95 is not, it doesn't protect you against the micro particulates, but I know that they're out there. the N95s. And I'm going to say a thing or two about that because I know that they're free. We're now passing them out for free. They should have been passing them out for free back in March, April, May, June, July of 2020, when, you know, back then. And they could have stopped all that nonsense about, oh, there's not enough for the healthcare workers. We had a different president. He just would refuse to use his presidential powers to, because there's something you can do where the president can just ask manufacturers to make a certain item, allocate the funding for it so that the people, the masses, could have access to it.
That's right.
So, and he didn't do that. I think it's defense powers or something, but defense spending powers or something like that. So if you are going, there are lots of fake N95s out there. So if you're going to use an N95, I mean, they can be useful to have it as a backup. Make sure that, I don't know if you can see this or not. There's something that's called a NOISH. Make sure it has that designation on it. Otherwise, it's a fake N95. You know, I use a Living Guard because that's the best. I have the best in this class. But if somebody gave me this for free, and I said, well, I'll keep this in my purse for somebody else, and if I need to, if for some reason I'm without a mask or. But
I'm sorry, could you repeat that? It has to have a NIOSH on it. What did you say? NOI?
NIOSH designation in order to, so that you know it's legitimately, because there's lots of fake N95s out. Now understand, there are limitations to an N95. An N95 will not protect you against, if you are at Coachella with 100,000 people, 10% of the population may be infected with COVID. That N95 is not going to protect you. You will need a Living Guard mask if you are at Coachella, and an ionizer, and some skin guard if you decide to go to Coachella. I'm just saying. So Justin, if you want to go, that's what you do. Okay.
Got you. 10-4.
Okay. And you know, there are people that are doing things. There are tents out there, like you can go and you can be in a tent. So if you don't do the tent thing, take that Pure, there's a smaller 12-hour air purifier that lasts for 12 hours on a charge. You can take the Pure, and I think those are like 30 or 40 bucks. And I would have, if I was in a tent, that's what I would use to purify the air inside the tent, especially if you're in the air, you know, you're in a tent with other people. Okay. And I would share a tent only with somebody who was vaccinated, boosted, and they also were practicing the biosafety protocol.
Right. Just all of the above.
All of the
From A to Z.
Okay. So I'm just saying, you know, you can go to Coach, you know, and you know, and I understand, you know, you might want to be in Coachella and everybody's walking around, they don't have their mask on or whatever. Okay, then bling out you can take your air tamer and bling it out, you know, and, you know, and just wear something really cool and just wear your, you know, wear air ionizer around your neck and have fun.
No, I speak for everyone in Hofstra when I say that.
You know, pardon?
I said right.
Okay. But, you know, but that N95 is not going to protect you as a mask, you know, not by itself. Any other questions? It's hard for me to follow the time here because it's only 4:20 here. So I think it's 8:20 Central Time. Is that right?
Yes, we have about 10 more minutes.
Okay, got you. Yes, Carol, the filtration rate on that Korean mask is less than 95%, so it's pretty much useless. Oh, so somebody, was it, now, Michelle, you put an article in here. COVID-19 pandemic guide, face masks, testing kits, travel and more.
Yes, that's from CBS News. So they have a spotlight on COVID essentials.
Is it better than what I tell people?
No, it is not. It's just interesting how, it's just little information. Face mask and a testing kit.
Oh, so they are, somebody's getting hip. Can you text that to me? Because I'm not in a position where I can
Oh,
copy
yeah,
it.
I can. Mhm.
Are there any other? Okay, and I think there was one other thing that we were going to talk about today in terms of the latest tech. There was the new testing, the cube.
Yeah, the
thing.
queue. And so this thing is extremely expensive.
Yeah, Michelle brought it up at the last meeting. So I took a look at it. If you can put a picture of it up, that would be great.
Mhm.
You can see what it is. No, it does. It's not like you can walk in your house and it detects COVID. That's not how it works. It's a testing system, and basically, and it uses a nasal swab, and it's as good as a PCR test. At least that's what the marketing says. I haven't seen the I haven't seen the research on it yet. I haven't had a chance to personally read the research on it yet, but they claiming that it's just as good as a PCR. The good news is that you can use it, the test results from this system, you can use it for travel for those countries that require a negative test, a negative COVID test upon travel. And something like this could be useful in certain situations. I'm not sure what the testing requirements are going to be going forward. My guess is I don't know. I shouldn't, I can guess about it, but I really don't know what the testing requirements are going to be. I had a friend who went to, she traveled from United States. It was over New Year's. She went to Abu Dhabi, and then she went to India to visit her mother, who's very ill, not from COVID, but just very ill. And she said she tested 7 times, and it costed a ton of money for her to do that. So for somebody who was, well, it would have been about the same amount. But she's also talked about how inconvenient it was because she had to go find a place, every time, and then she had to be nervous about, waiting for her test results and some different. Well, when she was in India, it wasn't so bad because she does speak Hindi. But something like this could be useful if you're in a situation where you're going to be in a country and you have to test frequently, very frequently. They give you the test results, I believe, in 20 minutes.
Mhm.
And it really, I don't know how many people are in that situation. I think I had one other person from our community who had to test that much because they went from, she went from London, and then she had to go to, she went to a wedding in Greece. So between London, she went to London, Paris, and then she went to Greece. And then she came back to London and came home. So she had a series of tests. So something like this might be useful for somebody that might be in a situation where they're going to have to take a lot of tests and they need to have a negative test result in order to, because I think at that point, you not only had to be boosted, but you also had to have a negative test in order to go into restaurants and or to get on a plane. This could be useful for in situations where you need to test a lot of people, because it is quick and easy. I don't know that it's practical. This is a practical home solution because most of us aren't going to be testing that frequently, just in our normal everyday lives. I tested at worst. At worst, I tested once a week because I went to go visit the Hutchisons, and so even I personally wouldn't need something like this. It is very expensive.
Now, the one thing that I'm noticing about this actual device, Dr. Busman, is that it offers e-prescription services. I don't know. People, I don't know if this is, I don't know. You would definitely have to look at it yourself.
E-prescription for what though? To get more test cartridges or?
I mean, it says I'm thinking that it's just from what I can read, quickly skim over, e-prescription services would probably mean that you could ask for a prescription through your doctor to the pharmacy. I mean, e-prescription for if you test positive at home. You can get your medications to the pharmacy. I would have to call these people and ask them, how could I do that?
Yeah.
Mhm.
I don't know. No, I don't know if this is really. I don't know. I'd need to know from the group. Is this something that
I think my thing is, I'm always suspect when a device like this, or I am suspect when a device like this comes to market, because if there is signs that this virus is, rescinding, you don't necessarily need a device like this. And to invest in this or to have investors to bring it to market, just to me, it signals that we might have to have this. I mean, I don't know if I would buy into it, but at what scale would who is going to ask for a negative test when we move about our daily lives? Because this is a lot of money to
invest in an object like this.
Exactly, to bring it to market for a virus that's only going to last for the next 6 months.
Well, we don't know that.
Exactly, that's what I'm saying, right?
And so that's that's the calculus that everybody's trying to take. Do I invest in this technology for something that may be on its way out? Now, they did say, one thing I did notice is that they're able to detect Omicron. The good thing, because one of the things that I worried about with the other tests that are out there now, the Binax, the iHealth, the free ones that they're giving to us right now. Because there was some question about if this, if Omicron, the reason why I personally didn't purchase any testing equipment back in January was because I knew, or I was thinking that at some point the current tests were not going to be able to detect Omicron. And I was concerned about, will it be able to test or detect stealth Omicron?
Right.
So this one detects Omicron. Would you need something like this? That depends. I don't know what everybody's situation is, but somebody mentioned it's crazy that they're dropping mandates. I think Carol said this. When we are nearing peak seasons of events, gatherings, and travels, graduations, weddings, etc. Okay, so maybe in June, we might be looking at a very different coronavirus COVID world at that point.
Mhm.
Omicron 3, the other tests are really no good. This one, this cube one is better. You're getting ready to have a wedding. You're inviting 100 people,
Mhm.
some of whom may or may not be. Like I went to this conference and we had to get tested. So, if you look at, at some point it becomes, how much does it cost to buy the BiMax? If that's $10 per person, but this turns out to be $8.50 per person if you buy them in bulk, then it might make sense.
It might make sense.
You know.
How much is the queen worth?
Well, yeah. I only reminded my child that, that's why we test before we go. Okay?
Right? How much is the queen worth?
How much she worth? She's probably, well, they have not, like, Patricia, can you answer that? She's still here.
Yeah, she's still there.
She's one of the wealthiest people in the world.
Exactly. I mean,
The amount of money that she controls is staggering.
yes.
Mhm.
And they won't even tell you how much she's really, they won't, you won't see it printed exactly how much she's worth, but it's staggering. Because that's all I can say. Yeah, okay. Staggering. So on that note, is there I want to make sure I answer any questions before we get out here. I don't see anything new in the chat.
So Justin, we have a new a guest coming in next Tuesday. Am I right?
I don't think it's next Tuesday
Oh,
because I
it's not
still need
next
to
Tuesday?
confirm. I think it's in March. It's in late March.
Oh, it's in March. Okay.
March 23rd. Yeah. And it's a young healthcare professional from out here at USC. And I'm excited to kind of discuss. We have discussions all the time, and I've known her for 20 years at this point. So a little bit more than 20 years, 21 years,
wow.
maybe. We've grown up together. So to just see her like medicinal track has been insane, from her starting med school to then getting like her master's and then doing some medical programs across seas to come back to start like residency and like her preparing for her fellowship and everything. She's seen medicine from a lot of different angles, and to now be enthralled with COVID and the things we've been saying before, like all these super spreader events, her morale is low as a healthcare professional and practicing doctor. So she is a practicing med school doctor in preparation to be a full, I don't know the actual terms, but she's in training. She's in med school, working for her fellowship. And I'm excited to have a colorful conversation with her and have the community weigh in on some of the things she'll have to say and some of the things she probably has a lot of venting to do because she's on the inside and she sees this for 14 to 16 hours a day. And she's going to want to emphasize the importance of staying strong and within like our own personal mandates. So our masks, our washing our hands, our hand sanitizers, our social distancing as best as we can, unless, we're prepared. We have our ionizers and everything. So we have our weapons. But a large majority of the populace does not. Both Black and just regular Americans are just out here doing what they want. So that's what has been torturing her, because she works with all these patients and then she turns on the TV or turns on social media and then there's another mass gathering like COVID is over. So it'll be kind of fun to kind of go in with her and hear some of her inside the arena comments she has.
Well, and I'm hoping that she will be enlivened by us because she will be, this will be a receptive audience who understands the importance of, the biosafety protocols, and and we want to lift her up and her service up too. Okay.
Mhm.
Yeah.
Yes. But that's I would want to. She just got back from Hawaii herself, doctor, and is now back in the battleground. Yeah, but I think she has to email her program and everything because that's how they get like their times off. And we're looking at March 29th.
Okay, great. So, and also, hopefully coming up soon, we're going to have a discussion about food, eating to live, and the things we can do to build our immune system, and food rules. So that's coming up. I don't have a specific date set up yet. And then also coming up is physical fitness coaching person, so that we can make sure that we're getting, staying as healthy as we can through this pandemic. I unfortunately gained I was so good in the beginning, but I gained that COVID-20, y'all. And I said, dang, but I'm back on it. I've been walking every day while I've been here, so I'm back on it to lose it back again. But so we have some exciting stuff coming up, and some exciting guest speakers that will be coming to our Zoom cast. So on that note, is there any other questions before anything else? Okay, well, as you can see, our motto is live and thrive, not just survive during this pandemic. Live your best life, live it fully. Don't be afraid to do the things that you want to do. Yay. This is the video. Yeah. Hawaii is a beautiful place. It is land that's been, you're seeing a video of land untouched by human hands. And it's just really, 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 really gorgeous. You can pretty much, with the tools that we've talked to you about, you can pretty much, lovely. Marjorie Lynn Bowden says she's back to doing concerts. Great. So we want to make sure that people are enjoying their lives, even in the midst of this pandemic. And we're not, BA2, I don't care what Delta, Epsilon, Phi, Mu, whatever. I don't care what virus variant comes forward. As long as you have your tools, you can pretty much live the life you want through this pandemic. You just got to know how to use your tools. All right. Good night, everyone. Love you. Take care. Live your best life.
Good night.
Good night.
Thank you so much.
Good night. Have fun.
I am.
Thank you.
Good
Don't run
night.
in, Dr. Blessing.
Thank you, Dr. Blessing.
Say that
Oh,
again.
right. Woo, sunset.
Okay, good night. Enjoy your holiday.
Thank you. Thank you, Patricia.
Yeah, take care.
You stay safe over there, because I know, it's going to be pretty rough with Boris Johnson.
Yeah, because everything's going back to normal. I think this is Thursday.
So he made the announcement yesterday, but it actually starts on Thursday.
Yes, that's right. Yeah.
Okay.
No,
Yeah,
I think the announcement is on Thursday. The full announcement is on Thursday.
He made the I heard it already.
Oh, really?
We watched it on television. Oh yeah.
Yeah, I can't keep up.
Yeah. So he was he was up on charges because he had violated the quarantine, mandate. So I guess he said, well, I can change that. I just changed the rules. So I can't be charged with anything. He just changed the rule. I said, okay.
Exactly.
Okay, so ain't got nothing to do with your safety, Patricia, or your family's safety. It's all about you protecting his eyes. Okay.
Yeah. But there's because we get free tests kits, but they're stopping that. We have to pay for them now, they're saying. Only people who work with the health service, with the social service, can get them free, but people who work in hospitals have to buy them as well. That's the argument that's going ahead at the moment.
Wow, that's messed up. Get your eye on.
So as though that tests won't be really important anymore by them doing that, because most people won't really test, and they're saying that they rely on the data that people get from the tests so they can work out what's happening in the population. So if they start charging, then they won't have as much data. So that's the argument that's going ahead at the moment.
That's right. That's right. And what was scary was if you test positive, you didn't have to quarantine or isolate. So
yeah, if you've had a vaccination, you don't have to. That's what they're saying. You don't have to self-isolate anymore if you've had a vaccination.
So I thought that even if you didn't have a vaccination, if you tested positive, you didn't have to.
Yeah, maybe. I'm not 100% sure.
Okay. Well, we'll check that out and take a look at that. But that was kind of scary to me.
Yeah, but the hospital workers, they won because they were against having vaccinations, a lot of them. So they won that. So they don't have to get vaccinated anymore. The hospital workers and the healthcare workers, they don't have to.
Okay.
Yeah.
Thank you for the video. Thank you for the video, Patricia. It's beautiful.
You're welcome. We have it on, I send that out as take a 20-minute vacation. Just sit back, relax, and watch the video, and watch.
Oh,
it's better when it rolls right along, but it's like looking at land that God has created that's been untouched by human hands, and it's
okay.
Gorgeous place. Yeah. Except for the part where you go into the city, but the rest of it, when you look at the hills and look at the volcanoes and on the valleys and stuff like that, it's gorgeous. It's gorgeous.
Okay. Well, you be safe and thank you so much.
Yes. The thing about now what is this? I don't remember this. Yeah. I mean, sometimes traveling and actually practicing the biosafety protocols, it really makes you stretch. And in terms of thinking through what it is that you need to do, and what it is that you may not necessarily have to do. So, but yeah, I'm very happy with all the tools that I have and using them on a consistent basis. So
yeah, things are about to go to another level completely. I'm sure you heard that Lightfoot made her announcement today too.
Yes.
Yeah.
I did. February 28th. It's going to be up to individuals and private businesses to decide what mandates they're going to have in place, but there won't be any statewide or citywide mandates. So So just because they're doing that doesn't mean that we should, we should just continue doing what we're supposed to do.
Well, my sentiment throughout the entire thing is use your best common sense possible. You remember when we very first started, and they were saying we did not need masks, that it was not airborne, and I was like, yeah, right. And then a few weeks later, just a few weeks, they were like, backtrack. You need to put on mask. Just you've needed to use your own a lot of common sense throughout the entire process. So I for one will continue doing that.
Yeah. Well, yeah.
Okay, love.
Pardon? I said some
Oh.
of it is science. I mean, and I don't know. I think everybody, at this point, everybody, it is common sense. Well, at least for this group, because I think we've done a good job of explaining the science, explaining how a virus is transmitted, and what it is that folks need to do. And it's gotten really simpler now, with you really don't have to, it's not like you need 50,000 things. You have your mask, your skin guard, and your ionizer, and maybe a disinfectant.
Yeah, I had a chance to listen to Roland a bit. Feel bad for him because he's still sick. And saying himself, and I thought I understood him say that he fought it twice. A couple of weeks ago, I thought he said, I've had to fight it twice. But he is saying that he's just still not 100%. But he's saying the same thing that you are. We are. Keep wearing, it's not time to come out of the mask.
Right. Yeah, he did say he got it very early on, perhaps before it really, he suspects he got it long, like in 2019, maybe early 2020.
Yeah.
Before we knew kind of like what it was. But he got it again recently. And yes, he is still, he's having some lung issues. He still gets breathless when he talks for a significant length of time. So, and this is a guy that's, worked out, was in the boxing ring, hiking, doing a lot of, the cardiovascular stuff that keeps you physically fit. He was waiting for the safer vaccine. So that's why he wasn't vaccinated. He was waiting for the safer one. And in the meantime, he acknowledged, and both on online, but also in private conversations too, that there were times where it's important to take a look at the situations that cause you to let your guard down. So he was like, I was out at some events, and I was around some people I got starstruck. I was around some people that I thought was famous and important, and I let my guard down. Next thing you know, that might have been one of the places where he had some exposure. So, yeah. I think about that in terms of, what are other times that people might let their guard down, at a funeral. Most people are not thinking about doing COVID protocols as they plan a funeral service because they're, understandably distraught about having lost their loved ones. And this is, kind of new, and you got a million and one things to think about and think through when you're planning a memorial service. So I get it that you're not going to, the COVID protocols may not be the first thing that comes to mind when you're thinking through a memorial service and a repast. But that's exactly the time when, because people are going to be in each other's face, they're going to be hugging. And I'm not saying you can't do any of those things. I'm just saying that, everybody, especially people who are older and have have comorbidities, older comorbidities or immunocompromised, definitely need to have ionizers for sure. For sure.
Okay, love. You take care now. I'm signing off.
All right. Take care, Dr. Cato.
Okay, Dr. Blessman. See you when you get back.
All right. Next Tuesday. I'll be
Next
home.
Tuesday. Okay. Then. Beautiful. Keep the pictures coming. Bye-bye.
Bye-bye. So Michelle, I'm gonna let you let that play. And I'm gonna